was really a research into the study of antibodies. At that point, immunology had reached a stage where it was possible to isolate the gamma globulins, and we knew that the antibodies were in the gamma globulins, and it was possible to study antibodies serologically. So that I would say that was a phase of immunology we could call serological phase. And we learned about the effect of radiation. Well, that's the main thing Dixon was studying then, the effect of radiation on the production of antibodies. And it was very interesting because if you irradiated the animal before you injected them with an antigenic stimulus, if you radiated them first, then they wouldn't respond to the antigen. But if you gave them the antigen for a day first and gave it a chance for things to start, you could radiate and they'll still make antibodies. So if something was different about at some stage of the process was radiosensitive and other stages were not. So that was how we got interested into that. And then I carried that on when I went to Chicago. And I worked with a man named Tolliver. Dr. Tolliver was, he spelled Taliaferro, but we pronounce it Tolliver. He and I had a close relationship. I had lunch with him once a week, and he was very allergic to animal dander, so he couldn't work. He couldn't work in the laboratory, but his wife was an excellent technician, and she did all the experiments that we designed. So that was very good. And I learned a lot from that.
And was that a continuation of the radiation work?
Yes. Dr. Tolliver was also interested in radiation, effective radiation on things, and he knew a lot about the histology of lymphocytes and lymph nodes and the lymphatic system, which was the obvious source of antibodies, because one of the things that Dixon had done was he showed that if you immunize an animal and after they have an immune response, you take out the lymph nodes or the spleen and inject the lymphocytes into another animal, you transfer the ability to make antibody with those lymphocytes. So we knew that the lymphocytes were the source of the antibodies somehow. And then, so that's, I would say, when we went from a serological phase of immunology to a cellular phase. And about that time, I say cellular immunology became very important.
And what is the importance of that difference?
Well, it's just a more basic understanding. We didn't discard what we knew about the serology, but we were going down to a more basic. So where's the source of this antibody that's in the serum? Where did it come from? And there was a lot of study around the world. There was demonstration of what are called plasma cells, and the plasma cells made gamma globulin, and there was a disease called multiple myeloma. I don't know if you've heard of that. That's a disease of the bone marrow primarily, and it's clear that the extra gamma globulin that these cells make are derived from plasma cells. So gradually we began to learn more and more about the cellular source of antibodies, and that's when the idea of cellular diversity came in. The fact that different cells made different antibodies.